Hello, hands off Green Bay!
Hey! Woo!
My name is Lynn, and I'm here to talk to you about something that is deeply personal to me and I think critically important to our community, and that is Medicaid. I am not here as a politician, and I am definitely not here as a policy expert. I am here as a mom of an adult son with developmental disabilities. He has received Medicaid-funded services since he was a toddler. And let me tell you, as a parent of a child with special needs, worry is your constant companion. But one of the things that has eased that worry over the years has been Medicaid. Because of Medicaid, my husband and I had peace of mind knowing that if the day comes when we can no longer care for our son, he will still get what he needs. He'll still see doctors. He'll still have a wonderful day program. He'll still live in his community. He will be cared for with dignity. That's what Medicaid has meant to our family and to so many families like ours. At least that's what I thought.
Woo!
Until about 3 months ago. That's when I found out that Congress was considering deep cuts to Medicaid. And then 6 weeks ago, the House passed a budget resolution that directs the Energy and Commerce Committee, and that's the committee that oversees Medicaid, to cut $880 billion, that's billion with a B, from the Medicaid budget. Boom is right, yes. So that number is almost too big to grasp, right? $880 billion. But I'm gonna give you some perspective here. If Congress eliminated every other program that the Energy and Commerce Committee oversees, except for Medicare and Medicaid, they'd still only be halfway to their target. That's how massive these cuts are. And yet our Republican elected officials are telling us, don't worry, these are just cuts to address waste, fraud, and abuse. People who really need Medicaid will still get it. There are millions of people on Medicaid who should just get a job. But you know what? That math doesn't add up. The Congressional Budget Office says that we cannot cut $880 billion without making very deep and painful cuts to Medicaid, cuts that will hurt real people. So when Tony Weed and Ron Johnson claim that no one will really be impacted by this, and that cutting waste, fraud, and abuse will actually improve Medicaid, that is gaslighting. And that gaslighting puts my son and 1.2 million Wisconsinites at risk. So let's get something straight. Medicaid is not wasteful. It has one of the lowest administrative costs of any healthcare system in the United States. It is not full of fraud. In Wisconsin in 2023, there were 143 Medicaid fraud investigations. 7 of those were charged and only 5 were convicted. Considering the billions of dollars in Medicaid funds that come through our state, that's a pretty good record. Every Medicaid claim is reviewed twice, and the data tells us consistently that 95% of Medicaid payments are accurate, and the 5% that aren't are due to administrative and documentation issues, not actual fraud. And people are not abusing Medicaid. The qualification process to get on Medicaid is very strict, and eligibility is reviewed every year. 7 in 10 recipients of Medicaid work, and those who don't are often very seriously ill. They are full-time caregivers, or they are children who shouldn't be working. So no, Tony and Ron, you're not getting to $880 billion in cuts by going after fraud and abuse. You're cutting people, real people, out of the care that they need. So when our elected officials tell us about how they don't want to hold town halls because they don't want to face all those angry people, I guess and it turns out you guys too, are some of those angry people. I am angry that these cuts are being proposed to pay for tax cuts for millionaires and billionaires who will never have to wonder if their loved ones will get the care they need. They don't lay awake at night worrying about that. I'm angry that after decades of fighting and struggle by disability advocates to get where we are today, people with disabilities and disability advocates like me still have to fight tooth and nail to be heard. In addition to all the other struggles we have in our lives, we are now expected to hold press conferences and show up at rallies and town halls and write letters to the editor, all while our elected officials hide behind closed doors. That's right. And I'm angry that we're expected to bear the most intimate details of our lives to prove that we or our loved ones deserve Medicaid. Meanwhile, the millionaires and the billionaires don't have to do anything but hold big fundraisers and make big political donations, and they get their tax cuts. So we know that our legislators and the millionaires and billionaires won't be impacted by Medicaid cuts, but who will be? Who uses Medicaid? 1.2 million Wisconsinites, 18% of the state is on Medicaid. Medicaid covers 1 in 3 children, 8 in 10 children who are in poverty, 1 in 3 adults with disabilities, and 4 in 7 nursing home residents. It covers veterans, it covers low-income women, it covers the people we love and the people who need it. If these federal Medicaid dollars go away, our state will be forced to make brutal decisions to cut people from the Medicaid rolls, to cut the services that are covered, or to cut reimbursement rates to providers. And none of these are good options. Cutting coverage or services means that people go without care. And in some cases, that means they go back to institutions that we have fought for decades to close. Cutting reimbursement rates means providers will struggle to pay caregivers a living wage. We already have a caregiver shortage, and we cannot afford to have any more caregivers walk away from this important work to take jobs that demand less of them, pay them more, and offer better benefits. The impact of Medicaid cuts will ripple outward to families, to schools and workplaces, and to our entire community. And beyond the moral cost of this, there is a huge economic cost. Medicaid brings $11 billion into Wisconsin each year, and $1 million of that flows into Tony Weed's own district. That money supports 4,300 local businesses in his district and 30,000 businesses statewide. And that money goes to providers to pay for Medicaid services that have already been provided. But it also flows back into our communities when those employees spend their paychecks on groceries, on rent, on gas, on diapers. The bottom line is, if we cut the Medicaid dollars flowing into our state, we are cutting the legs out of our own community. So, yes, that's right. So as you can imagine, I could go on and on about Medicaid at this point and what it does for people like my son and what it does for our community. But instead, I'm going to leave you here today with a couple of takeaways. The first one is that since 1965, Medicaid has literally saved lives. It has helped millions of Americans live with health and dignity. It reflects our values, our belief that we care for one another. That's the Wisconsin I know, and that's the Wisconsin that I'm hanging on to for dear life these days. That's right, that's right. And if our elected officials vote to betray those values just to give tax breaks to rich people who don't need another dollar, then we need to hold them accountable. That's right, that's right. And number 2, Medicaid is not political. It's personal. 9 out of 10 Americans, that's Democrats, that's Republicans, and that's independents, will rely on Medicaid at some point in their lives. This is a fight that should unite us. And to make it crystal clear, I'm going to do a little experiment here. I'm going to ask you to raise your hand and keep it raised if any of the following statements apply to you. Do you know a child who has been in birth to 3? All right, that's Medicaid. Do you know or have a child, keep them up, please, keep them up. Do you know or have a child who's in the Katie Beckett program? All right, that's Medicaid. Do you have or know a student who gets speech or physical therapy in the schools? Yes, that is Medicaid. Do you have a grandparent in a nursing home whose savings have run out, but they are still getting good care? Yes, that is Medicaid. Do you know someone with developmental disabilities who is in a day program at the CP Center or at a Spiro, or is getting job coaching so that they can work in the community? Yes, that is Medicaid. Do you know anybody, do you know someone or do you love someone who gets Meals on Wheels or who goes to the ADRC to get services? Yes, that is Medicaid. And do you or someone you know use Badger Care to get the health care that you need? Yes, and that is Medicaid. So look around you. This is the face of Medicaid in our community. These are the people and the services we are fighting for. So here's your calls to action. First, I want you to call Tony Weed in Ron Johnson's office, and I want you to call them every day. Tell them that we will not stand for cuts to Medicaid. Tell them that we see through the waste, the fraud, the abuse that they're dealing out. And tell them if they vote to cut Medicaid, we will remember at the ballot box. And second, I want you to get involved. There are some mini flyers that are floating around here in the crowd, and they have a QR code on them. Scan that QR code and fill in the form, and we will send you Medicaid updates and opportunities to advocate. And finally, please stay involved, because what we know is that there are power in numbers, and together we are absolutely unstoppable. Thank you.